Alright, so we could talk.
You'll edit it out.
Well, the whole thing is gonna, AI will, I'll look through the plugs. Right, so your bite used to be like, the lower jaw was bigger and more forward than the bottom than the top, right?
Mm-hmm.
The reason you have that metal wing in there was to kind of guide the upper front teeth to go forward.
Mm-hmm.
Now, when you look at it from the side, you smile, I can see the top teeth now at this angle. If I would take that metal frame out, when you go down straight, you're gonna go like this. That was actually the hardest thing to do, right?
Yeah.
Because typically, like orthodontists see this, whether you have this kind of bite, they're gonna make a cut right here and advance this forward. But now you don't have to.
Yeah, I know that's what you were saying. The bite was sort of in the back of your mind of like making sure, because I think you mentioned too, like you weren't sure. I mean, obviously you never know how much expansion you can entirely get.
We can get a lot of expansion.
And then the question was, how much?
How much is too much?
How much is too much? And like, I know that we couldn't do much about the arch of the upper palate. You were trying to figure out like,
the top.
Like yeah, because
like if you go to drop down.
Like the tongue placement.
Yeah.
You know, you said we can get expansion. I just don't know what we can do because you had a pretty high arch.
Yeah. The way I sometimes like to explain this is, it's almost like the center, the top, the highest portion of the palate is not going to change. It's not going to change where it is, but the wings might open. It's almost like airplane wing. You know, right?
Yeah.
It's like doing this, right? So now all of a sudden, the Gothic art that we were dealing with now is not as. I mean, it's still going to be high, but it's not going to be as high. But we're now opening up the wings, right?
Yeah, and I don't know if it's just me or I mean, there's a lot of stuff in my mouth, but like, it does feel like, in a weird way, like my tongue wants to go up.
Yeah.
Like it just naturally, like just sit there.
Yeah.
You know, versus I don't know. It just feels like my mouth is at a point where when I shut my mouth, like my tongue wants to sit up.
Yeah.
And it has space.
Yeah. More space.
And I want to close, like, I think that's the key, right? I want to close my mouth so my tongue can go off, so I can breathe through my nose. Like.
Yeah, so just tell me, I mean, these are things I don't have the knowledge of, obviously. I know, I can see the changes, but tell me, like, what have you experienced, like, in terms of, you know, when you do exercises, when you breathe, when you sleep?
So I think the first thing I noticed after the first week or two, where it was, like, that pressure was intense, but at one point when it finally split, I guess, we're starting to really split. I remember I was brushing my teeth and like then all of a sudden like you could like the smell like it just you
like the toothpaste smell.
Yeah, the toothpaste smell. Which
so
I never really,
had before.
I never really experienced that. Like I was like, whoa, like when you can feel it in your eyes and like, so. And then when I went running, a lot of times when I go running, like exhaling too, like breathing in, breathing out was like stuttered almost, but you know, it's more of a flow.
Yeah.
And then each turn and stuff, it was just looking forward to like expansion, just to get more.
So, have you noticed that you're like we're not turning that much now. We're turning half just every 2, 3, 4 days.
Yeah.
So when you make that turn, do you physically feel the change in terms of flow now?
The last turn I did, which was
Sunday.
Sunday. Yeah.
Yesterday.
It was weird because like I did the turn, like half a turn, and it just, again, it just felt like I wanted that. Like it was like I did it, and I was like, and it felt like it was opening up. Like it was just like, yeah.
Did you feel that every single time you turn?
Recently, I'm starting to feel it more like I want to. Like the only pressure I feel is here, but it's nothing. It's no pain. It's whatever. But it just feels. It just feels like it's opening up better. And then I feel like my tongue wants to creep up.
Yeah.
And I think the eyes can get watery, and my nose gets really like itchy and
Yeah.
stuffy, like, you know, going through the changes sometimes. But then when that clears up, you know, and you just like get that sense of airflow, it's nice. I think it's sometimes a little hard just with so much stuff in your
Yeah,
mouth.
yeah. You'll get to point where we're
And
gonna get it.
talking and stuff, but it's yeah, no, I think it's not nearly as like any turn. It wasn't painful.
Yeah.
Just to me, it was just stress, but
Yeah.
stress.
Okay.
So I think that was always what I was curious about when you had answered me about like, are we ever able to close? How much can we close that gap?
Yeah.
It sounded like you're like not so concerned with that gap,
yeah.
more concerned with the bite.
Yeah, so the bite is really determined by, you know, how your lower teeth is still angled in a little bit. So we're using Invisalign now to upright them, right? So the question is, how much can we upright these teeth to fit the bite? So meaning that if I expand you, just say like if I overexpanded you by this much, but your teeth is still tipping in, the teeth don't really line up, right? So some of it is determined by how much we can do this, right?
Which is what we're doing down here.
Which is what we're doing now.
Yeah, because I'm only on tray, 4 or 5, so it's a long way to go to see.
Yeah.
So is it more of a waiting game just to see how much this we can straighten out?
Yeah, so that's why I don't want to overextend you that fast,
Right.
because I need to now. You could get to the point where overextend you. I need to close you back up.
Right.
Right.
So as I expand, what happens? It expands and it just sort of sits there,
Yes.
and then each time I expand a little bit, it's just a matter of waiting to where we're like, okay, this is good, and then it can start to settle. Or
Yeah. So what's really happening biologically is like we assume the suture is split, right? Because you don't feel any pain, there's no sounds. As you feel pressure, it's normal because it's stretching the soft tissue.
Yeah.
But imagine the split already gone, it's done. As you stretch more, your body is still depositing. You try to deposit bone in between. Now that bone deposit takes a long time. Right? So imagine when you take a tooth out, it takes 4 months to heal for the bone to completely solidify. We're not dealing with that big of a gap, right? So I think the thought process is always 8 months post like for your last turn. There have been a little, I don't want to push, but I've seen other practitioners that have moved teeth into that space. I mean, the gap that you have is like about 3 millimeters now. So we potentially we can actually slowly close the gap as we expand, because you're on the wire that's on the same trajectory. So as you kind of move around, we're not really closing the circumference. We're basically just moving around the circumference.
so is this braces here?
Yeah.
Is that? Do you tighten that every so often and try to close? Is that what we're doing with these
Yeah, so
braces?
typically, what I want to do is actually later on is probably not today, is to put a rubber band in between, so that there's actually tension to basically bring the teeth together.
Okay.
But you can't bring it together. You can only bring it on this track, because think about the wires as a track. Right. So it's moving on this track, because I can easily pull you back to close the gaps, but that's not what we're trying to do.
Yeah, and I think it was Dr. Lipkin. Is that the one? Yeah, like he seems to say in a lot of his videos, he's like, "Oh, this stuff, I'm not quite where I want the expansion. I'm way right. Like once we get to that expansion, then we can."
Yeah, moving teeth is frankly the easier portion, and the bite. I think the bite is
The bite, yeah.
the challenge.
Because we don't know how much ultimate expansion I'm gonna want or get, or
Yeah. Yeah. So there's something called SFOT. It gets a little complicated. Basically, like spreads your lower jaw, because the lower jaw and the upper jaw moves very differently. So the lower jaw, for you to move bodily, it's not possible because the bone is hard. So there are times when, again, the surgical procedure, you go in there and cut between the bone to move teeth to get maximum expansion. I think your lower jaw wasn't bad to begin with, right? Your tongue kind of fits in there. It's
Yeah.
just that you can't lift up into that space,
Right.
right? So, one of the goals that eventually we're going to need is actually get the tongue to function in now a bigger space.
Yeah.
Right?
Yeah. I think that would, in my mind, it was get it split, get it open as much as we can,
Yeah.
deal with the bite and all that stuff, and trying to get it aesthetically looking, and then doing myofunctional therapy and getting that tongue to cause that pressure to keep it,
Yeah. And
locked
eventually
in,
tongue release.
you know, and then, I don't know if do you know any ENTs that specifically work with sleep or these issues?
Yes, there's somebody in, it's BU now, but it's the old, what's it called? St. Elizabeth. So,
Just because, like, I mean, and I don't know, I know that online it just seems like a lot of the people that go through this, one of the women I've been following, she went to an ENT and she was excited to go back because what this particular ENT did was he knocked her out
yeah.
and watched her sleep and watched her tongue
I see.
and watched the opening and watched sort of like what was happening. And I've seen that a few times.
That's in Texas, though.
Is it, yeah.
Right? Was it
I
in
think
Texas?
it might have been there, and
Yeah.
in far away, some guy in England was doing it, and
Yeah.
he's like, I do it to all my, because I just want to see what's going on.
Yeah.
Because I think it's like a question of what is it? Is it the tongue that fit? You know, there's some reasons.
Yeah.
I mean, obviously to circumvent that, it's like, well, we're going to learn to have the tongue live up there. We're going to open up the arch as much as possible so we can breathe better. We're going to slow breathe,
Right.
you know.
So I think the benefit, there's definitely a benefit doing that. There's a question. There's nobody, at least from what I know, in New England that does it. There's not many, based on my knowledge. But what's kind of good about doing this is we'll put you on the sleep test as we make changes.
Yeah.
So
And I think we talked about earlier, like you're sort of addressing the components of what they might find. in
that's
that.
right. Yeah. Because we want to see the results change
Yeah.
as we move along the
Right.
trajectory. Right. So you might not get the full benefit of it, even from all this crazy expansion we did, based on the data. But you might. Right. We just don't know where you fall along the spectrum.
Right. Yeah, because I was always curious, and like, if somebody is is it the tongue falling back? Is it has nowhere to go? Is it your airways are too narrow? Is it like, what is it?
We have your CT scans. I already know that's your airway.
I see it right now.
Yeah. So CT scan shows that your tongue. Again, this is when you're sitting up. The tongue itself is just, it's massive compared to the airway that's behind it.
Yeah.
So when you're going to sleep, so that's why even at this current time, if I do a sleep test on you, you probably have to fill in similar results. It could even be a little worse because it's taking up the space. Only when I take this out, and your tongue learns to function in that space, that's when you might get an improvement.
So is it possible, do we do another CT scan? Like, I always wondered, is it possible that it didn't quite split, or are you pretty confident that it didn't split? Because when I turn it, it doesn't, there's no pressure. There's pressure, but it's not like it was at first.
Right.
Like
It's very different.
Yes. The first couple of weeks was like, oh shit, I gotta turn it. Like, and then like, I remember I took my kids to the zoo and I went and I did the full turn and it was almost like he's gonna be able to take it and I'm gonna break that thing, you know. And then that's when it went like I felt like that crackling and
The pain.
moving weird stuff in my face and I was like, whoa. And then my wife was like, oh, like nothing. I think it's good because it wasn't like that pain. It was just,
I think that's the point where it's stretching enough that the sutures is about to separate.
Yeah.
And then when you bite into it, or you put your teeth together, go like, now it's.
What's really cool for me is like I had a deviated septum. So when I got my septoplasty about a year ago, he did it here, but I still feel like, I don't know, because I know I was always sort of like this my whole life.
Yeah.
And so he did that, and he mentioned to me, he's like, I can't really do anything here because sometimes at night, like if I'm like this, I'm like, it's like more opened up.
Sure.
He's like, we did a septoplasty, so you can breathe through East nose.
Yeah.
But we didn't do anything here. And what I noticed is when I've been doing this, like, especially recently, like, this side
The
now
flow is now-
feels like
Yeah.
different. Like, I feel that flow.
You can flow on the
You know,
left nostril.
so,
on the right
yeah, you're
nostril.
right. Yeah, so it's almost like the more I do it, I'm like, because
Yeah.
I feel like that's what I want. Like,
Yeah.
like but I guess that bite thing, because I can't right now,
Yeah, you're hitting on the metal.
you know.
You're hitting the metal frame on both sides.
That's tricky too, right? How much can we straighten this? How much expansion? Close that. Like, it's hard for you to probably.
Yeah, so
Yeah,
I'll do some
like-
I'll do some measurements today. I'll just take a look. So I'll have some idea of how much we can gain, and then there is a rule. I mean, obviously, my job becoming a guardrail. I don't want you to overturn it.
Right.
So there's a guardrail. Maybe that's within 2 millimeters of range. We think we should go, and we'll maximize that.
So, is there any danger of the expansion with like interfering with like facial muscles or sinuses or anything like that, or?
I mean,
Pretty
so
safe.
you're connected right here, right, between the zygoma and your maxilla on both sides. So that's why when you turn it, so that you'll feel pressure right here.
Yeah, and my eyes water. My eyes water, or like I feel like I just want to itch my nose, or whatever. It goes away.
So I'll just tell you, like, my typical range of maximum expansion is 40, 42 maximum, maybe. But also to see if your teeth will support that much expansion.
So it's getting the maximum expansion we can do with getting the bite decent.
Yes. Yeah. So like what I mean is, like, in general, I would not extend people up to beyond 42.
Right.
Even like the maximum. Now, if you're started at 37, we have 5 millimeters. If you start at 40, we got 2 millimeters, right? So even though that we're using the number 42, maybe your lower teeth does not support 42 either. So we also have to kind of consider that bite compared to what we're trying to achieve.
So you might have to go back at some point. If,
Not at this point, I don't think, but that's why I want you to slow down. I don't want you to overturn it and then, we now have to turn back.
Now, is that's for bite reasons or aesthetic reasons, or both,
Turning back,
or just
bite reasons.
bite reasons?
Because you could have one side that's so far overextended that your lower teeth doesn't meet. You don't want to be creating. I mean, you can breathe better, but your teeth go out.
Yeah, that's what I was thinking in my head. I was like, how important is the expansion versus having like the perfect bite?
Yeah. So it's within reason. Because we can still move teeth into place, but at the same time, you don't want to be like, now we just spread the teeth out this way, and then now I'm gonna have to turn this back in to fit over the bottom teeth.
Yeah.
Right. So, all right, let's take a look. Okay.
Yep.
All right, let's pause this.